cost, while 29% said prices would stay about the same. So will public opinion affect how the president proceeds with health care reform? Here to discuss this is the president of the Word Doctors and pollster, Frank Luntz, is with us. Frank, good to see you. Thanks for being here.
Thank you.
All right, first of all, you study words, language. This is what you do, and you come up with the best terminology to use during debates like this. For example, you have Luntz lessons, and you go through the first one. Humanize the approach, acknowledge, quote, the crisis. Explain those two.
You have to humanize it. This is not about healthcare, the healthcare system. It's about people. It's about mothers, fathers, children, grandparents. And what is happening is that if you just talk about the system itself, you lose the personal approach.
And acknowledge the crisis?
You have to admit that if people aren't insured, it's a crisis for them. If they can't get tests for their kids or they can't get treatment for their parents, it's a crisis. Don't try to fight the definition. Let the public define it. You have to have the right solution.
All right, one thing that I'm not really sure how to interpret, time matters most, delayed care is denied care. Now, that doesn't mean to rush into a bad policy.
Correct, but time, that's the essence of having to wait for treatment, having to wait for tests. If it takes weeks or months, and this is what happens with breast cancer, this is what happens with other types of treatment. If you go to Canada or Britain, you could wait 4 months, 6 months, even longer for the operation that you need.
Who should decide health care? Politicians, bureaucrats, or Washington? Great question.
It's a rhetorical question, and you don't even have to answer it. Because the public says, I don't want any of those people making the decisions for me and my health.
And either side would argue that health care quality, getting the care you need when you need it, and that would be good for both sides, that type of language?
The key there is that it is not just the issue of covering people, it's the issue of how you cover them. It's what you provide to them. Health care in itself is not good enough. They want it to work. They want it to make you healthy again. And that's not what the Democrats are talking about.
And one size doesn't fit all?
Because we're different. Sean, you and I, you're in shape. I'm not. I'm going to need more health care than you're going to need.
That's not necessarily, by the way.
But you can't say that everyone has
you don't work out?
Everyone. Yeah, I work out with my fingers, my polling fingers.
Good. All right. They got the economy wrong. How do we trust them? I think this is a great argument for Republicans. How do we trust the people that screwed up the economy, that said unemployment wouldn't go above 8% with health care?
It said to us that with this bailout that things would change. Healthcare is the most important decision that anyone's going to make in their lifetime. It is truly life and death. It's not about buying a car. It's not about cable. So you got to get it right the first time.
All right. Now, we have been continuing our ongoing series. You have been analyzing all the different ads that have come out. And you have one ad that came out this week that's the best and one's the worst.
Correct.
Let's look at the best first.
Absolutely.
Let's roll the tape.
Almost everyone agrees we should reform health care. But many in Congress want to create a government-run health insurance plan paid for by taxpayers at huge cost. Independent experts say tens of millions of Americans could lose their current health insurance and wind up on this public plan. England already has government-run health care, and their breast cancer survival rate is much lower. If you fund a lump, you could wait months for treatment, and potentially life-saving drugs could be restricted. Government control of health care here could have meant that 300,000 American women with breast cancer might have died.
This did well with Republicans. Why?
Because it's personal. It's not an unseen announcer. It talks about the consequences of getting it wrong, and it focuses on the time it takes to get treatment. These are the things the Americans care about. Now, we're about to see another one that the public didn't like. One of the rules in healthcare, don't bring an actress to talk about healthcare. What does she know? Let's take a look.
Hi, I'm Edie Falco, and I support Health Care for America Now. I spent many years without health coverage. I know the feeling of hoping that your symptoms go away before you have to get money together to see a doctor. I know that worrying about it makes it even harder to get better. I still have friends and family in this position. My situation is different now. I have health care, I have good doctors, I'm treated very well, and I'm grateful for this. I also know that no one person is any more worthy of such treatment than any other one person.
Both Republicans and Democrats didn't like it that much.
They reacted in the dials to what she said, but the reaction when we spoke to them was, what does she know? She plays someone on TV.
A mobster's wife, of all people.
And now we're going to trust her with health care, so that's a mistake.
All right, now, one of the things, you have been doing some polling, and I want to share this with our audience here. The first question you asked is, how effective is the government at regulating health care in the United States? Now, extremely effective, 0.6%. Very effective, 3.1%. very ineffective 32, extremely ineffective 20.5.
That's a majority of people who don't believe that the government has done its job on health care. And now you want to turn the entire health care system to them? See, this is all meant as language.
Right.
Ask the question. If these are the people that gave you the post office, gave you the IRS, and gave you Katrina,
And Department of Motor Vehicles.
do you now want them to give you health care?
No, the answer is obvious. And obviously they're screaming no. I mean, the American people are screaming in that poll no.
And the next question, who do you blame for the high health care costs? As much as the insurance companies are in second place, number one, waste, fraud, and abuse.
Well, who do you blame? Waste, fraud, and abuse, 47.5. Insurance companies, 42.5. Malpractice, and this is where tort reform, I think, needs to be a part of any solution.
Lawsuit abuse reform.
31.5. Pharmaceutical companies. I'm surprised that they don't blame. Government was not an option here.
Except that waste, fraud, and abuse,
That's
they
government?
see that as government.
They do.
And what they're asking is, before you raise my taxes, you solve your problem. Before you take more money out of my pocket,
Fix what you're doing wrong.
fix what you're doing wrong, and tell me exactly how you're going to spend it.
You know, the very people that bankrupted Social Security and Medicare. Which of the following best describes the way in which you want to think of yourself when you use the healthcare system? A human being. 32.5%. That seems like the logical answer to me. A patient, 26.8%. That's fair.
And yet, you know what happens if you are in the public plan or the government plan?
You're a number.
You're a number. You're a Social Security number.
Impersonal.
Is that how you want to be treated?
No.
That's the issue.
Yeah.
That's why these matter.
All right. Which consequence of government involvement in healthcare would anger you more? And these are very predictable to me. Waiting weeks or months to get a procedure or treatment that you need, 44.4%. The rationing of health care, which I think is going to be guaranteed, folks, rationing, 26.3%. American seniors may be denied treatments because of their age. Now, we actually, Betsy McCoy found that provision on page 425 of the bill, that they're going to give counseling to seniors about options. That sounds to me like they're going to say, well, you've lived a good life, maybe you should go.
What happens if they don't even tell seniors what their options are? This is how the Germans ration care. They simply don't provide the information. You don't know that you could qualify for a specific procedure or a medication. Sean, it's frightening.
Yeah.
And the most frightening thing of all, and I say this to everyone who's watching right now, if a mom has a child who desperately needs tests and treatment, and that mom can't get that child care right then and there, that's a crisis.
That's Canada. That's Great Britain. That's France.
And so
that will be America.
And if you believe this out there, you've got to use the right words to communicate it effectively.
All right. Government-run health care. Very effective.
Takeover.
Government takeover of health care. All right. Got to get this perfect. I got to get just every word in its proper spot. Frank, good to see you.
Thank you.
And coming up, Senator Jim DeMint, sound of the rally cry.